Greetings, everyone. Today, I want to welcome Dr. Patricia Young to the show. Dr. Young is the owner of Restore Physical Therapy and Wellness Center in Hadley, Massachusetts. Let's get started with Dr. Young today. Dr. Young, can you share a little bit about yourself and your story and how you decided to choose physical therapy and specifically focus in on women's health issues?
Well, my interest in women's health issues, I think, started because of my own personal birth stories. I am the mom of 3 children who are now grown, but each child that I had a very different birth story. And the way that everything transpired really made me aware of how women were cared for throughout pregnancy and postpartum and the actual delivery itself. And that's sort of what gravitates me to working with this population. So I actually went back to PT school at 39 when my kids were, like 12, 10, and 4, because I was going through a divorce and I had finished my undergrad and part of a master's degree, but I'd been out of the workforce because I had been home with my children. So I was like, I need to get back into the swing of things and be able to support myself in a manner that I would, felt comfortable with and what have you. So I, at the time, was doing personal training. I was a gym rat and loved working out, and I loved being, helping other women get back in shape. So I went back to PT school, and I gravitated towards the women's health piece because of the birth stories, but also because it was talking about stuff that a lot of people don't like talking about, which is in the field we call pee, poop, and sex. Nobody wants to talk about it because they find it so personal and so upsetting. But once you're in a room with a pelvic floor physical therapist, you realize, there's no judgment, there's no stress. We just talk about what makes the patient feel comfortable and get her the best answers for her situation.
Great. Well, and you kind of described a little bit about what women's health physical therapy is. What are some of the top 5 women's health related diagnoses that you might see in physical therapy? Like, what are the most common problems that women come to see you with?
Okay, that's a great question. Women's health I look at as a whole spectrum. So we see people in my clinic from adolescents all the way up to our elders in their 80s. And there's a common thread because I love doing the full, you get to look at the full spectrum. But when you look at the top common things that come into, that people have concerns about, it's urinary stress incontinence, which means when women leak, when they cough, laugh, or sneeze. That's urinary stress incontinence. There's urinary frequency, which means you feel like you have to pee all the time. I see prenatal pain because women come in with their changing bodies and their joints hurt or their back hurts or their pelvis hurts. So we put them at ease with offering them sometimes manual therapy, sometimes certain exercises. And then postpartum, the same way, after you have a baby, your breasts are heavy from the milk coming in and holding the baby up in your arms or on a pillow, then the neck gets sore, the upper back gets sore. And oftentimes these women will present with rectus diastasis, which is all the big hot topic online right now. That women are very curious about, and that's when your abs split in the middle due to accommodating a large baby. A lot of women, it grows right back the way it's supposed to, but some women, especially women that are super flexible, can have a harder time with that. So physical therapy can assist with that by doing different myofascial techniques on the belly, as well as wrapping the belly and appropriate, progressive type of exercises. So how many was that? 3, 4? And then
go ahead.
Pelvic pain. Sometimes women will come in because they have pain with intercourse, penetrative sex. So what we look at is, is there tissue dryness? Are there myofascial restrictions, like different changes in the tissue, if you will, due to giving birth or having a stitching after giving birth? Or the hormonal changes that happen, postpartum and breastfeeding, as well as all the way up to menopause and postmenopausal. there's sometimes there's atrophy, and there's hormonal changes. So we look at all these pieces together with the intention of educating the woman and, restoring her confidence in herself and hopefully improving her quality of life.
That's great. Well, and one of the reasons I wanted to have you on today is because my audience has asked a lot about exercise and fitness. And I know as a mom that many women won't ask, how do I actually exercise without peeing my pants? They'll ask, how do I exercise after pregnancy? That's the question. But the question underneath that is, how do I exercise without leaking?
Right.
And I am not a pelvic or women's health physical therapist, but I have a little bit of knowledge from an external standpoint with helping people reestablish their pelvic floor, helping them understand that core is not just abs.
Correct. Yeah.
Core is
absolutely.
Yeah, it's abs, it's the back muscles, it's the diaphragm, it's the pelvic floor. What do you say to women when they come in and they want to get back to running or jumping or even squatting just to pick up a load of laundry, and they're having that stress incontinence, or sneezing, coughing, things like that? And what do you say to women, like, what are not specific exercises, but are there exercises they should be avoiding? And how long does it take to restore some of that muscle strength in their pelvic floor muscles so that they can start to do normal activities and exercise without leaking?
Sure. That's a really great question. When women come in and they ask about running, for example, that's or they want to get back to CrossFit, something like that, something that's really a challenging activity. There's a myriad of factors that you have to address. So, for example, if she comes into me, and what we would start off with is an orthopedic exam, because I want to look at, like you said, her posture, how she's breathing, and check her muscle strength and her alignment. So the first thing I can tell you that I would say, whatever I find there, is you have to start with walking. And I tell women, start walking uphill, because you're going to engage your core a little bit more when you're challenged to walk up a hill. So you get that high of that cardiac, your heart's going, you're feeling good, but you're also engaging more than you would if you were just kind of strolling on level ground. So that's one thing. So the other thing is checking for the rectus diastasis that I had mentioned before, if you have a split in your abs, because what you want to consider, if that's happening, you essentially have a breach of your core, if you will, that has to be corrected. So the one thing I tell all women now is that before you want to run after you have a baby, I highly recommend that you just get evaluated by a pelvic floor physical therapist. I think that should be part, and all of us that are in pelvic floor physical therapy, tell the world that we're kind of screaming to the world that you've grown a human being in your body for 9 to 10 months. And you need to be reassessed, not the 6-week checkup. Yeah, you're good to go, meaning your blood pressure is fine, and your stitches, if you had them, are feeling fine, and whatever. There's a much more comprehensive way to look at a woman to ascertain where she's at and be able to guide her in a progressive postpartum rehab program. So that's what my colleagues and I like to do. So when she comes in, I will give her really gentle isometric core stability exercises. In other words, after you've had a baby and you're standing with the big belly and you're kind of lurching forward and your lower back is kind of compressed because you're trying to hold this baby up, and then the baby is born and your posture has to do some reintegrating back into the way it was. So that is like a major component of doing rehab after you have your baby, because if you look at a postpartum woman frequently from the side, she kind of still stands like she's pregnant, but she's not, because she's carried for so long. So you want to look at where her certain shifts are that you can gently help her recorrect, so that she stands in an upright posture, that she has good diaphragmatic breathing, and she can feel the connection between the diaphragm and the pelvic floor. I think historically, Western medicine has always treated the body little components. Your leg hurts, your arm hurts, your head hurts. And what we're doing is really looking from an integrative approach at how biomechanically, how she's moving, how all the joints in the body are moving. What does she look like when she walks? How does she hit the ground? So if she's walking kind of side to side still, because you do that when you're mighty pregnant,
right?
That and make her mindful of it, and do some, myofascial work and some mindfulness with her and some therapeutic exercise to allow her to sort of reintegrate into her, before baby body. Does that make sense?
Yes, absolutely. What should a woman expect as far as the duration of time to fully recover? I've heard different ranges, and obviously it's going to be different for everybody depending on what they have going on. But I've read articles for athletes, professional athletes who've had a baby, and in the article, this is from, I believe it was Athletic Therapy Today, they said it can take up to 2 years for a woman to get back to the level she was at, because they consider it a traumatic experience. And I think about my own pregnancies, and I'm like, it was a traumatic experience on the body.
That's a really good point, because there's so many components to this. There's, what kind of shape were you in before you had the baby? And that is not to guarantee that your pregnancy and your delivery are going to match that. So it's really a trusting position to be in when you're pregnant and when you give birth, and what the postpartum experience is. What kind of baby ends up in your arms? Is that baby stressed? Is that baby calm? Does that baby sleep? Does that baby feed well? All those factors play. There's so many factors that play into your whole recovery period. So the first thing I tell women is practicing the self-care and listening to your body. So when she wants to get back in shape after the baby is here, it's the first thing is making sure she has the right amount of nutrition, that she's getting plenty of good sleep, finding the best support that she can have in either her familial tribe, and if that doesn't work for her, her friend tribe, or reaching out to the community to like La Leche League or support groups or Mother Woman, all these different organizations in the realm of her neighborhood, or even within a 10 or 15 mile radius, so that she has other women that are in the same boat that she can reach out to. So there's that. It's the constitutional piece, I call it. Like, how do you feel? Are you tired? Are you depressed? Are you happy? Are you exhausted? That has to be the foundation, and the self-care piece, and feeling centered. Because if that's not, going out and trying to over-exercise, is just going to increase the stress level. Right. It's just going to, I think in our culture too, it's like, have a baby, get back into shape, be really thin and look gorgeous, and
there's so much pressure. There's so much pressure to get back. Maternity leave is 12 weeks, but that doesn't mean that you've recovered at 12 weeks. You might be going back to work, or some women, they don't get paid for their maternity leave, so they go back at 6 weeks. Right. And they're not recovered yet. They're still adjusting, whether it's their first child or whether it's the third or fourth child. There's an adjustment from their body standpoint, and from just all the factors around being a mom with adding another child. And then if you have twins or triplets, then you magnify that even more.
Absolutely.
One of the other questions I wanted, you mentioned before, women who need to be stitched. There are many women who have degrees of prolapse, or they have degrees of where they ripped and did have to be stitched. When they go back to exercise, if they've done the basics of what you said, they did the self-care, they have a good support system, they have the nutrition, what are some exercises that they might need to avoid right away, because maybe their core isn't all back, or they have this prolapse, so they don't want to necessarily have surgery to heal that. So I just see a lot with like boot camps, and their friends are doing boot camps, And I usually am very cautious and say, you know, I don't think you're ready for that, or even a jumping or a CrossFit. It's not that those are bad. It's just that women who have some of these conditions, can they get back into that? Or running, can they get back into that? Or are they going to do harm because they have a condition now that they don't want surgery for? And, you know, can you expand on that?
Yes, absolutely. Yes, most of them can get back to it, but I think what needs to be emphasized is that it has to be done in a progressive fashion with a skilled person helping her. Mm-hmm. In other words, I have seen people, they'll come into me and say, well, I'm trying to do X, Y, and Z program and I'm jumping rope all the time and I'm leaking. If you're leaking when you're jumping rope, you shouldn't be jumping rope. It's basically your body's way of telling you, guess what, your pelvic floor is not strong enough. So you would seek out help to do that. And the other mistake that people often make, and they're told, well, just do Kegels. As you mentioned previously, it's the whole core. The pelvic floor cannot hold you up by itself. It cannot hold up all your organs, you know, your bladder, your rectum, your uterus. It can't hold that all up without the support. I tell my patients, it's like a symphony of muscles that work together to support you in exercise, because you're moving forward, backwards, sideways, up, down, lifting things, not lifting things. So what you want to make sure that people do is that they address the whole body, the breathing, the posture, and all the core exercises. Again, that's why I recommend that people get to a really great pelvic floor physical therapist, so that all those issues can be addressed. If she goes for, I don't know, she notices that she has a prolapse, then and the doctor says, you have a prolapse, I recommend you go to PT, then she can go to PT and get physical therapy for it for the next couple months or so, and progress on that program. And if in fact it doesn't look like it's going to retractograde, we can't fix a prolapse, but we're hoping with strengthening and posture we can improve it a smidge so it's not so irritating or such a what do you call it, a profound impairment in her life. You know what I mean? We just want to improve the quality of her life. So there are women runners who will wear a pessary, which is a small plastic object that the OBGYN can fit you for that will hold things up a bit so that you can run. And there are women that take it in and out. There are women that wear it more frequently depending on how bad. Also, it depends on so many factors, which is why patients will come in and they'll have read stuff online. And it's really important that you get the right information, you talk to the right people, and that you're an individual. Nobody else is like you. So you have to be looked at and you have to be examined. You can just discuss with the clinician what works best for you, not a blanket statement that's said online that can be sometimes very scary.
Right. So yes, and I agree, just really with any type of exercise program, not just the pelvic floor piece or the women's health piece, is that progressive type of a program. As you know, if somebody can't reach point A with their exercises, they shouldn't be going on to point B until they're ready. And it sounds like with this is probably even more important to do that, because if they're not ready, the consequence is either worsening a prolapse-like condition or you being embarrassed because you didn't hold your bladder in public, or you didn't hold your bowels. I've had, that's even, more of an embarrassing situation, and you can't help it. At that point.
So it's backing it up and being really progressive in terms of how you engage your body. I mean, you have to realize it took you that long to grow a human being. You have to be kind to yourself and just gradually work yourself back in. Now, are there exceptions to the rule? Yeah, I've seen women that come in that they got genetics in their ballpark and they recover super fast. They had an easy pregnancy, an easy birth, but we have to stop comparing ourselves to everybody. It's honoring who you are and doing what you need to do to have the best recovery. That's what I emphasize to everybody.
What are some, to the listeners today, what are the signs or symptoms that someone should be aware of, like, oh, this isn't just post-pregnancy, or this isn't just menopause, like this could be a real issue that I need to address sooner than later. So what signs and symptoms might they be experiencing that they're thinking, oh, it's just I'm aging, or oh, it's just, I just had a baby?
I think that if anything, I'm gonna like open that up a little bit. I think if anything raises your eyebrow, or you have a flag, or something doesn't feel right, you have to listen to your intuition and go in and discuss it. And if you don't get the answer that makes you feel comfortable, you go to somebody else and you ask again, or you go to PT. There are sometimes women, I'll tell you one thing, they'll present with hip pain in the front. And one person's perspective might be, oh, it's just your ovaries, you're ovulating, or I don't know, you might have pulled a muscle. So we have to tease it out as PTs, and we have techniques, during our exams to ascertain if it's musculoskeletal, if it's a muscle issue. And if we can't, then they are better to be served by their primary care provider, their OBGYN, to look at that. If there's bleeding in the stool, a lot of times women after they have babies, of course, can have hemorrhoids depending on how long they were pushing or how much stress they had endured on their pelvic floor when they were pregnant. And they should have that checked out to ascertain that it's just the hemorrhoids and it's not a concern in that regard. And then any pelvic pain that they can't explain, whether it's pain with sex or pain at the suture site to make sure it's healed correctly. They could still have the suture area heal, the stitching area heal very well, but still have pain with penetration after that. And a physical therapist can work that out. The midwives and the OBGYNs will ascertain that the tissue is fine and there's no infection. But then at that point, you could go to a PT and have her work with you to resume some more tissue mobility and pliability so you felt more comfortable.
And is that the step sequence that they would first go to their primary care or the OBGYN, talk with them, and then come to a pelvic floor or women's health physical therapist?
Yeah, they can, or they go back and forth. I mean, PTs have direct access. If they came to me and I couldn't find that I felt comfortable with in my exam, that it was in my scope, I would refer her back and say, you should go have this checked out with your OBGYN. Or they go for the 6-week checkup with their OBGYN and everything looks good, but they don't feel good. They send them on to PTs. I just personally think that all women, after they have their 4 to 6 week checkup with their OBGYNs, should then have some time, like they do in Europe, to have a postpartum rehab period so they restore their bodies the best they can, whether it's just for the rest of their life or in preparation for another baby, if they choose to expand their family.
Great. Wow, you gave a lot of great information today and insight. I think a lot of women probably have these questions, but they don't know who can answer them. And they don't really think of a physical therapist all the time who, they think a lot of people will think of physical therapy as rehab after surgery for like a knee or a hip, but they don't always think of the women's health side of things. And it's certainly an emerging aspect of our profession.
Absolutely.
And I don't think the word has gotten out of physical therapy for pelvic floor dysfunction, for urinary incontinence, for stress incontinence, and all of the other specialties that you mentioned. One of the things, just to kind of recap a little bit, in terms of exercise after pregnancy or after a dysfunction, maybe somebody's had a traumatic experience as well. It sounds like, really focusing on the self-care, the nutrition, the sleep, the support system, kind of making that the foundation. Absolutely. And then starting to progress into something that's more aggressive, but conservatively aggressive. Absolutely. If that makes sense.
And you had asked me too, and I don't think I answered this, what not to do. Sit-ups are never a great exercise. You don't want anything that's going to increase inter-abdominal pressure. You're pulling up and bending in half and literally pushing your organs down to your pelvic floor. You don't want to do that. there's no functional reason to do a sit-up. So your PT would work with you to gradually progress your exercises. But I'll give you an example. I start with isometric exercises on the table, on a mat, face up, face down, and sideline. So she can, I tell them I'm working around the world, you know, up, back, side, get all that. Once she feels comfortable with that, I have her make it progress it a little bit more difficult. I'll have her like stretch out a leg while she does the pelvic tilt or reach overhead. So she starts increasing the length of her levers, her limbs away from her body to challenge her core. Okay, she's got that all mastered. Then I progress her to stuff in standing. She's not jumping around, but she's standing, doing exercises in that format so she can practice upright, you know, posture and breathing. And I also do stuff in the chair or sitting on the table so that she can work her glutes, her rotators by moving her legs in different directions. So she starts to feel solid in her core by exercising on different planes. And what I mean by that is sitting, standing, lying down, and then progressing it to more dynamic exercises, a little bit more moving around, so long as she doesn't have any adverse symptoms. If she doesn't, then we just keep making it harder and harder. If she does, we back it down. The other piece I didn't mention too that I recommend is that it is cool. It's an okay, great thing to do to wrap your belly after you give birth. Other cultures do it. I don't know why Americans lost that. And I know the hospitals around here, if you have a C-section, they'll give you an elastic wrappy. But I tell all women, it's nice to be like held for a while until you feel with your exercise program that you're starting to pull in and feel more solid. Because after you have this baby, the baby keeps growing. The weight keeps getting higher and higher. So you're bending over constantly, lifting and feeding and changing diapers. And that is an exercise you do all day long. So it's sometimes, I just tell them, wrap yourself, buy a wrap. I love the company. Not that I'm doing a pitch for them, but I just love what they put together, which was Mama Strut. So they're shorts you pull on that have a wrap at the top, but it also has a strap that you can pull up between your legs so you support your pelvic floor, and you can put an ice pack in it, and you can put an ice pack in your low back if you need it.
Oh, nice.
It's like this yummy system that holds you all together, and they're trying to get it established as a durable medical equipment piece, so you might be able to get it reimbursed by your insurance company.
Wow, that would be great.
Yeah, so sometimes women will say, well, I go for a walk after I have my baby and my pelvic floor feels like it's gonna fall out, or my pelvic floor feels heavy. So if she wraps, that's obviously she's not strong enough yet, but if she wraps and pulls the shorts up or whatever she wants to use, it just helps you feel more held as you work your way back through your recovery period. Right. I just find it.
That's a great tip. That's a great tip. But the key, it sounds like, is that first of all, there's hope. Like you don't have to go through this alone. And that's what I see a lot, you know, where I'm not a pelvic floor therapist, but or a women's health therapist, but when I have patients in general come in and they feel like they've exhausted all of their options, and then all of a sudden you give them hope, and sometimes the tears come and sometimes the smiles come, and it's just letting the listeners know today that you don't have to go through this by yourself. There is help, and you can work through this. It may not happen overnight, and there's no quick pill that's going to fix it. And it may not be necessary to have surgery either. Not everybody's a surgical candidate.
No.
There's options there for people, and there's things that they can do, and there's things that other people around them can help them with. So I really appreciate you coming on today and sharing your expertise with pelvic floor issues, women's health issues, and where can people contact you if they have questions? I know you're in Massachusetts. This podcast is going to go out all across the country, but where can people reach out to you?
Well, I work Restore Physical Therapy and Wellness would probably be the best place. We have a website, restorewell.com, that they can reach out to us on, and I'm happy to get back to anybody and converse if they need a little info. We're trying to get ebooks out. We have stuff that you can download online as well.
Excellent, excellent. Well, thank you so much for today. Ladies who are joining today, that's it for today. But until next time, be bold, be beautiful, and be you. Thank you.